Amelia, ND, MPH, and Amy Slott, MPH, serve within the HIV, STI Prevention and Surveillance, HST policy and partnership sections to work with state community partners to publish HIV, STI, and TB education, prevention, epidemiological, and intervention efforts across Oregon. These remarkable public health luminaries have worked in national and international CD, policy, clinic care, and epidemiology. Their relationship in STI and 340B carceral partnerships has and will continue to revolutionize the way people in prisons and jails receive care. Welcome.
All right, thanks. Thanks for letting us wrap us up today. And thanks for the introduction. Again, my name is Amy Slott. I'm an epidemiologist at the Oregon Health Authority. And we're excited to share our partnership, 340B partnership between Oregon Health Authority and Department of Corrections. If you don't know what 340B is, don't worry. Amelia is really great at describing it. So moving on. Okay. Okay, so we know that people in custody face higher rates of infectious disease. And in fact, rates of hepatitis C among those in custody are up to 10 times greater than that of the general population. And this is a syndemic impact, meaning that there's a co-occurrence of individual epidemics and health and social conditions that interconnect and amplify one another. And these are fueled by inequities such as limited access to healthcare and social determinants of health like unstable housing, poverty, discrimination, and substance use. And in correctional settings are critical touch points for intervention. And in fact, for some folks, this is the only healthcare touch point. And it's federally mandated to provide healthcare that's equivalent to what's available in the community. I mean, it's debatable whether we want to strive for that these days in the US, but that's another topic. The syndemic framework underscores the need for policies targeting root causes to disrupt cycles of infection and social determinants of health. We know that focusing just on the infections alone is not going to be sufficient. And Oregon's 5-year plan to end HIV, STIs, and hepatitis C includes strategies to increase services in correctional settings. Hand it over to Amelia.
Thanks, Amy. So as Amy just outlined, there's a clear need for comprehensive health services to address this endemic, and we need to create effective mechanisms for delivering those health services to people who are incarcerated. One of those mechanisms is 340B. I know that not everyone in the room is familiar with 340B, so I'll give a short overview. The 340B drug pricing program is a federal program. It's administered by HRSA, and it requires pharmaceutical manufacturers to provide significant discounts on outpatient drugs to eligible providers who are known as covered entities. Those discounts are usually between 20 and 50% off, but in some cases they can be more than 99% off of the wholesale acquisition cost, so pretty significant discounts. There are a bunch of different categories of covered entities, each of which has its own criteria for participation in the program. But the one we're focusing on here for this partnership is the STD type designation, which is available to recipients of federal funding authorized under Section 318 of the Public Health Service Act. The Oregon Health Authority currently receives 3 different Section 318 grants, which are listed here. Those are the STD, Strengthening STD Prevention and Control Grant, the Integrated HIV Surveillance and Prevention Grant, and the Integrated Viral Hepatitis Surveillance and Prevention Grant. We are also able to pass that 340B eligibility along to our partners by making them subrecipients of this funding, and that's how this partnership works. So when we provide Section 318 funded support to a correctional facility, in this case to the Oregon Department of Corrections and all 12 of their facilities, that facility also becomes eligible to apply for covered entity status and to participate in the 340B program. That allows them to purchase those steeply discounted drugs for patients in their care. And finally, covered entities are expected to reinvest those 340B cost savings back into activities consistent with the authorizing federal grant, which in this case means STI, HIV, and viral hepatitis services. So key takeaway here for those of you who are new to 340B is that these partnerships can be used to reduce cost barriers and to redirect available resources towards syndemic testing, treatment, and prevention. Next slide, please. Thanks. So we began our 340B partnership with the Oregon Department of Corrections in 2020. We provide them with Section 318 funded support, including reimbursements for condoms and lubricants, which are distributed to folks at release. We provide printed educational materials and also technical assistance. By receiving that support from us and thus becoming a Section 318 subgrantee, the Department of Corrections has been able to enroll in 340B and access those discounted medications. Their cost savings are then reinvested into patient care and services that support this endemic work. And as part of our agreement, they share their quarterly screening data with us at OHA. Amy is going to present some of those data in a few slides. Next slide, please. Thanks. So this slide is an overview of what the Oregon Department of Corrections has accomplished so far using cost avoidance from 340B. And I'll start by noting that the first phase of our partnership, starting in 2020, was really just focused on developing the infrastructure needed to scale up the syndemic services and implement 340B purchasing. So that required a lot of training, a lot of systems and workflow development, and the creation of new policies and procedures, which is why the first really notable thing on this slide is in 2022. That took a couple of years to get things up and running. But by June 2022, they began seeing significant cost savings from 340B, and they were able to hire a second clinical pharmacist specifically to support hepatitis C treatment in their facilities. In January of 2024, they implemented an opt-out screening model for all individuals entering state custody. This expanded the initial health assessment encounter that every individual receives to include screening for HIV, syphilis, gonorrhea, chlamydia, and hepatitis C. The model also incorporates recommended vaccinations for hepatitis A and B and HPV. This strategy is intended to help reduce stigma and normalize testing, and to ensure that everyone gets tested, including those who may not perceive themselves to be at risk for certain infections. In 2024, the Department of Corrections also began their STI awareness clinics. These include group education and an additional option for folks to schedule one-on-one testing and provider appointments for STI concerns or any other health concern. And jumping back quickly to opt-out screening, I do want to note that opt-out screening at intake has been really challenging for the Department of Corrections to maintain continuously due to high staff and leadership turnover, especially at the one intake facility in the state, Coffee Creek. So it's been challenging for them to maintain, and we've seen it go up and down a bit. But this does continue to be a central goal of our 340B partnership with them. And the challenges around maintaining opt-out screening have really emphasized for us the importance of having champions working within the prison system to keep this work going. Next slide, please. Okay, so the Oregon Department of Corrections has been a really fantastic partner in this work for us. And one of the many benefits of our partnership with them has been just having them as a thought partner around what it would look like to establish similar partnerships with county jails across the state. So we've been able to kind of brainstorm with them and take their feedback, lessons learned from this partnership to inform the creation of a correctional partner toolkit, which we are currently piloting with potential county jail partners. And then additionally, part of the infrastructure that they implemented to support their 340B program is a split billing system. And because of this, jails may be able to partner with the Department of Corrections in the future as a contract pharmacy to take advantage of that split billing system. That's just something that could significantly reduce administrative burdens relating to 340B participation for jails. So that's really a huge resource that we hope to leverage moving forward. And I will pass it back to Amy to walk us through some of the evaluation data.
Okay, thanks, Amelia. So we have some kind of key evaluation questions. The first, and these are very basic. The first is, has the 340B cost savings at Department of Corrections, has it led to expanded STI, HIV, and other services, hepatitis C services? And how have these cost savings been reinvested? And Amelia described how those services have been reinvested. So the clinical pharmacist, the STD screening, and the STI awareness clinics. And I'm going to show just some preliminary data. But before I jump into that, I just want to kind of review the challenges and opportunities. The first is the Department of Corrections relies on an external lab. Amelia mentioned that we received quarterly screening data, and the partnership started in 2020, but you'll see when I present the data, I'm presenting from 2023 on. That's because kind of every data pull was different and the case definitions were different, so we couldn't really track trends over time. There's limited utility in terms of result data. We weren't able to tease out new infections versus someone coming in with an infection, and the race ethnicity data we're not presenting or reviewing because it's not self-reported, it's reported by law enforcement. Currently, there's no treatment information, and Department of Corrections is not able to share the actual cost, the dollar amount in terms of cost savings because of their agreements with the pharmaceutical companies. Opportunities, these are big ones. They are currently rolling out their electronic health record. Apologies if you already heard the story, but I had the opportunity to go and do a site visit, and they showed us the medical room. And some of those charts are like 40 pounds heavy. So it's a big lift to scan all the medical records into their electronic health system. And then universal screening, as Amelia mentioned, could be a challenge and an opportunity under both. It was rolled out in 2024, but as Amelia mentioned, because of some transitions in leadership on the medical side, there was kind of a gap, but they're working hard to reinstate universal screening if they haven't done so already. Okay, so this is looking at kind of comparing before and after opt-out screening. So comparing 2024 to 2023, the number of tests increased by 30%. That's the orange line there. And then the blue line is the people, the number of adults in custody increased by 14%. So this is looking at people screened by test type. And so hepatitis C has remained the most common test among adults in custody. I'm really curious to see what quarters 2 through 4 look like in 2025, just because of that gap. We did see like a little decrease the end of quarter 2024, and the way that Department of Corrections explained it was because they had kind of saturated the folks that were interested in getting testing. Okay, next steps. So the electronic health record rollout is going to be a really positive shift in patient care and reporting. So we'll be able to get just better data all around, result data, treatment data, demographic data, and then some of the social determinants of health like substance use. And then just reflecting on the partnership, we feel like it's been a transformative tool to reinvest savings into patient care for STIs and hepatitis C. And And these days we need to be as flexible and creative as possible. Some of our references, I do want to highlight that first one there, Amelia and Rob Nutt, the chief pharmacist at DOC. They were interviewed in this syphilis policy playbook, and they talk about the 340B project, so it's worth checking out. And big shout out to our colleagues at Oregon Health Authority and Department of Corrections. I think you'll be able to have these access to these slides so you can reach out with questions. And our puppies, thank you for your attention. Thanks.